Today we're here talking about a very big joint, the hip joint. It's a ball and socket. And I wanted to tell you one of the most commonly seen injuries I treat in this clinic, a hip labral tear. 22% of all athletes suffer from hip pain, and most of them don't know why. The majority of them have a labral tear. A labral tear is when the connective tissue inside the ball and socket that keeps the femur, the large bone in the socket, tears. This connective tissue tears and really does not repair very well. Unfortunately, this can cause unrelenting pain. The athlete can't return to sport. They're throbbing at night. The leg hurts when they're just standing there or lying in bed, and no one knows what's wrong. There are simple tests that a physical therapist can do to identify a labral tear. There's also some radiology that you could go and get a specialized MRI called an MR arthrogram, which can identify a labral tear. But most often, if you go to a sports physical therapist like myself, you don't need it. Labral tear pain can be fixed. It can be improved. You gotta go to the right person. So the most important thing you need first is to find a physical therapist to assess and treat the labral tear. Once we've identified it, we're going to calm the inflammation down. How do we do that? Through laser therapy, through cryotherapy, which is ice, through specific manual mobilizations of our hands. I have to reset the normal biomechanics in your body. Most of the time, a labral tear is caused from improper biomechanics. The way you're walking, the way you're moving wrong, or the way you're running wrong. So you've got to have someone check your biomechanics and fix that. There are top 3 movements you should not do with a labral tear. The first one is bringing your knee all the way up to your chest and twisting your foot. This causes torsion or torque in the femur. You should never do a deep squat. Everyone loves to do squats and lunges. You should not do a deep squat or a deep lunge. That is bad. And the last thing is there are some specific yoga poses where you're bringing your knee towards your chest and you're torquing your femur. That's deleterious for a labral tear. And when you're going through these rehab, I would not be jumping and doing plyometrics. Keep the joint calm and reduce that inflammation. But at the end, once we fix the labral tear, the problem is it can come back if you don't fix the weak muscles. So having someone identify the muscle asymmetries is the key to keeping the labral tear at bay. Thank you for listening.